Hey, welcome to another episode of Clear Light Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Special guest today is Dr. Jennifer McCracken, and you are a doctor of immunology and allergies?
Correct.
Kind of, sort of, I get it. Okay.
Yeah, we like to say allergy and immunology, but either way works.
Okay. I would have tongue-tied that pretty badly. So tell us what you do at UTMB.
So like I said, I'm one of the allergy doctors at UTMB. I see adult patients, so really actually 10 and older, but we take care of patients who have seasonal allergies, drug allergies, food allergies, asthma, eczema, hives. We are immunologists, so we take care of people who have problems with their immune system and have recurrent infections. And so mostly I see people in the clinic. We're more of an outpatient type doctor, but we do see consults in the hospital occasionally as well.
And I imagine business is booming given where we live. Tell us about what are the worst times for allergies and what do you commonly see?
Yeah, so when we're talking about seasonal allergies, we just had a terrible spring. Oak trees are what pollinate mostly in this area in the spring. So tree pollen in particular was all that yellow stuff we were all seeing all over our cars and the sidewalks and things. And it was really at like historic highs this year, so it was a difficult spring. If I check the pollen counts today, actually the tree pollens are going down a little bit, so I think people are getting a little bit of a respite right now with their allergies. But grass pollinates in the summer, so people who have a lot of summer symptoms get ready. And then weeds tend to pollinate in the fall, so things like ragweed tend to be the big allergens for people who have a lot of fall symptoms.
And most people, are you born with allergies or do you develop them over time?
So you really develop them over time. People are probably born with a predisposition or are more likely to develop allergies, but it takes time to develop them. You're not born with them. It actually takes usually a couple years of being exposed to an allergen before you develop an allergy to it. So if you have a little baby who has a runny nose, it's more likely due to like a viral infection or something like that. It wouldn't be allergies yet.
Now, and I know food allergies tend to be really... Are they more common now than they used to be? Or, you know, what does the data say?
Yeah, they are seeing an increased number of food allergens or food allergies lately. There's some different hypotheses on why this is happening. A lot of people think, it's the hygiene hypothesis comes up. I don't know if you've ever heard about that, but they actually think we're probably a little bit too clean now.
We don't eat enough dirt.
Correct.
Like
correct. Yeah,
kids.
I mean, there's lots of studies out there that look at kids raised on farms versus kids raised in a clean city environment. And the kids who were raised on farms and dirtier, if you want to call it, have less allergies than those that are raised in more of a clean environment.
So my guess is the last couple of years hasn't done anything to help that then, because being clean is
all our
obviously,
hand sanitizers and all. Well, we'll have to see how it all plays out. I think it's a little early to see, how the last 2 years has affected development of food allergies, but maybe.
Okay. Tell us you're also an assistant professor.
Correct.
And so that you obviously do some teaching. UTMB's obviously well known for. So do you do rounds with students, or what does that look like for you?
Yeah, so actually I'm involved in teaching in a couple different ways. So I'm involved with medical students, and I'm actually a course director for one of the first year medical school courses. And so I teach a lot of immunology to those bright-eyed, bushy, medical students, super eager to be in there. So more in a classroom setting. And then also I am one of our fellowship directors. So when people have gone through and done a residency in internal medicine or pediatrics and they choose to subspecialize in allergy, that would lead to an allergy fellowship. And I'm involved in the training of those fellows who will spend 2 years learning to be an allergist. We also have medical students and residents who have some interest in allergy, spend time in our clinics and see patients together or take them to see the patients that we're seeing in the hospital. So yeah, a lot of interaction with trainees.
Do you enjoy one over the other? Is it the medical side or the teaching side?
I really like both. So that was probably one of the biggest reasons why I wanted to stay at UTMB, is that I really love patient care. That's why I became a doctor. I want to see patients, but I really like interacting with the trainees and being involved in some of the education. And you just don't get that if you go into private practice.
Yeah. How long have you been with UTMB?
I actually did all of my training at UTMB. So I went to medical school there. I did an internal medicine residency, a 2-year allergy fellowship, and I've been out of training now 6 years. So I think that's about 15-ish years or so I've been down at UTMB.
It's very common. A lot of the doctors that we've interviewed have that similar experience where they come and they end up staying.
Yeah.
What is it about UTMB that you think makes that such a common story?
So I think I had a great education. Like, I felt very prepared when it was time to move every step of the way. The people that work there make a big difference. I think the environment is very friendly. There's a great sense of collaboration and camaraderie. And I really feel a lot of support from the people that work there, both leadership and my peers that I work with. And so it's just been sort of a natural progression to just keep moving forward with UTMB.
Yeah, it sounds like it's a great culture. And,
yes,
and
that's a good word.
You can tell by the way all of the people on the podcast have talked about the culture of UTMB.
Yeah.
And it's really hard to build that culture. It's kind of easy to ruin them, but it must have taken some time. And
I mean, many places are great at teaching and you get to see patients and all that, but it really makes a big difference, the culture, like the people surrounding you, making it a fun experience to go to work every day and providing that support that you feel like you need.
So what are some of the more uncommon allergies that people in this area kind of develop?
Well, when we talk about the allergies that we see a lot of, like I said, the environmental allergies, which aren't really that unfrequent here. Food allergy is becoming more common. But then we also see people who have allergies to different medications and things that, for example, today there's a patient in the hospital that had an allergic reaction to a chemotherapy medication that she needed. And we are helping her do what we call a desensitization in the hospital, sort of tricking her body into tolerating some important medicine that she needs to treat her cancer. And so we get to be involved in a lot of really cool stuff like that.
So what's some advice for either keeping your allergies in check? I know, you talked about this spring. I think everybody had an allergy to oak pollen this past spring. It was so thick. But what could we be doing to minimize the effects of allergies? So
when we talk about maintaining or trying to get good allergy control, there's really 3 different avenues to talk about. One is if you know something that you're allergic to, we try to avoid it. Some things are easier to avoid than others. Like, for example, the pollen, we can't really live in a bubble, but we could try and limit our time outdoors if possible. If you do spend a lot of time outdoors, change your clothes, shower, when you come inside, keeping your windows closed, just things like that. Medications are really important in managing allergies. Being consistent is what I would stress to most people. Is allergies don't, especially this spring when things were so terrible, you don't respond as well to taking medications just as needed. It's something that you should really take a daily type medicine. And then there's a lot of medications over the counter now that are easily accessible, in particular like the nasal steroid sprays and things. That's a great thing to start. And then people who don't respond well to allergies, allergy shots are a great option for those people that are on a lot of medications and don't have great control, or people who are looking for more of like a long-term permanent solution.
Now, so I know a lot of my nephews and nieces had peanut allergies, but they seem to have outgrown them. Is that how it works? Can you outgrow an allergy?
So when you're talking about food allergies, there are definitely some allergies to or certain foods that people are more likely, our kids are more likely to grow out of, especially ones like milk, egg, wheat. If little children or infants have problems tolerating those, there's a pretty decent chance that as they get older, they will lose that allergy and be able to eat those again. It is less likely for things like peanuts, tree nuts, shellfish, for people to grow out of those allergies. What's really exciting is there's actually a lot of research in food allergy right now and trying to find ways to induce tolerance in people so they can be able to either eat a little bit of this particular food, or it protects them from severe anaphylaxis if they were to be exposed. There's actually one FDA-approved medication for peanut allergy. If people were to pursue a treatment like that, it doesn't allow them to eat a peanut butter and jelly sandwich again, but it would protect them from severe anaphylaxis if they were accidentally exposed. But it's a really cool field of research. I think food allergy could definitely look very different in 5 to 10 years than it is today.
So exciting stuff coming down the pipe.
Absolutely, yeah.
Excellent. Anything else you want to tell the audience about the work you do or UTMB?
Yeah, well, I think for allergy in particular, a lot of people think it's not that big of a deal. I'll just live with it. I'll just go take some Benadryl from the store or something like that. But one of the biggest things I love about allergy is it's a lot of simple changes can really improve people's quality of life. So I always encourage people, even if it's preventing you from sleeping at night or, having to stay home from work a day, or you avoid activities because you don't want to be exposed to the pollen, or you can't get a dog because your kid's allergic, or whatever it may be, that there's so many options. And I love being able to, like I said, improve people's quality of life. They come in the next time they see us and they're like, oh, my nose is so much better, or we finally got that dog my son was really wanting, or I've been able to, go out to the soccer fields with my kids. And there's just so many options that I think people don't really realize.
I hope my kids don't watch this episode. They busting my chops about getting a dog,
Yeah.
and one of them's allergic.
It's still a good excuse if you want it to be, but we could help you if everybody was on the same page.
Well, thank you. It's been a pleasure.
Yes, thank you for inviting me.